This is Dr. Alvin Philipose, and I'm going to be discussing what the difference between dry needling versus wet needling is. And just so you're familiar with our office, majority of my practice is combined of using dry needling and prolotherapy. Those are for patients that suffer from chronic pain conditions, severe muscle spasms, things like herniated disc, bulging disc disease, chronic knee pain, and shoulder pain. So, what is dry needling? Dry needling uses an acupuncture needle that's inserted into muscle tissue, and the goal is to reduce the pain and inactivate the trigger point. So, think of it as you got a hose going in, you got fluid going in, and all of a sudden you got a kink because that muscle is just kind of in a knot. So, you don't have the good stuff coming in and the bad stuff going out. And the whole point is to restore function. It's rarely used as a standalone procedure here. Normally, I offer it as a broader chiropractic approach, incorporating things like adjustments, maybe some stretching. I'll use like a Theragun or something to kind of help stimulate and get that longer result. So what does dry needling feel like? Well, I use a very thin needle. The initial feeling of the needle entering the skin is very minimal, much less than a vaccination or having a blood drawn. Once the needle reaches the muscle, there's a twitch sensation, which feels more like a deep cramp, and it doesn't last long. 15 to 30 seconds is normal. There are some occasions where I'll actually use a electrical stimulation, which is usually a minute to 2 minutes as well. Typically the results of this type of treatment is 1 to 2 days, which is then when I recommend patients go into some heavy stretching, and that kind of gets the body to kind of readjust and reconform those muscles and that muscle memory. So the first few treatments usually have a short length of relief, but over a period of time, combined with things like decompression therapy and stuff, the span will start spreading out over a couple of days, and then the results are actually going to be long lasting. They will typically go into a depth of 10 millimeters or into the subcutaneous tissue. Now, I say that, and for my herniated disc patients, I do have a deeper needle that'll go into the multifidi muscles, which is your deepest muscle that you can get. And I do have a technique that'll get that deep pressure to almost resolve almost immediately, which allows you to go in and do exercises and stretching. As most of my patients know, the first 3 weeks is to get you some sort of relief so that you can actually start doing stretches and daily activities without having to worry about it. And the rest of the time, we go into more of a corrective care. There is absolutely no medication used in dry needling. Dry needling is 100% natural. So versus acupuncture treating meridians, so if I have a headache and treating my hand, we actually go straight into the neck area or find where the headache may be coming from. And that's how I kind of approach it. Dry needling, compared to traditional dry needling offered at most physical therapy places, my technique is very minimal discomfort. I have a lot of years of experience with injections. Majority of my practice has been injections for over 22 years. And there's certain even ultrasound techniques I use to get precise, so that way I can get maximum results with as much less discomfort for my patients. Wet needling is, for me, the same technique as dry needling, except I use a natural solution that's injected into the surrounding tissue, whether it's tendons or ligaments or joints, that can strengthen and reduce inflammation. Types of wet needling is prolotherapy or prolozone, neural therapy, which is a natural treatment that focuses on acupuncture points itself. Sometimes I'll even use that same technique as a natural trigger point injection. I also do a B12 scar tissue treatment for patients that have had failed back surgery or any type of pain along a scar. Those techniques are pretty cool because patients will see a result pretty fast. So sometimes when they do surgery, you can get the scar tissue wrapped around a nerve root or a dermatome that produces some discomfort. So this type of technique works pretty good. So which one is right for you? Well, I typically will review any type of imaging you have, whether it's an MRI, old x-rays. I love my digital motion x-ray, which is a video motion x-ray. You'll see it on some of my other videos, which I can see you in motion, which is when most people have discomfort, or if there's any type of cervical instability, any type of atlas instability, that'll kind of help me out. I also use an ultrasound to help kind of find where that inflammation or damage is. And then I'll utilize either one or all the techniques to make sure that you get the best results. So to see which one is right for you, you can call me at 405-848-7246, and I'll be more than happy to help you answer your questions.